So, then in AMP2, what we're going to start, what we're going to cover is going to be the rest of the chapters that we didn't cover in AMP1, of course, for sake of time. But the first 3 chapters are related to the cardiovascular system, which is basically the system of the body that is in charge of transporting oxygen, nutrients, partly also to carry away wastes, and including CO2, and transporting water, and also producing molecules like enzymes in the neutrophils that protect us from infections. So, the title of the first part of the cardiovascular system is the heart. So, the cardiovascular system has 3 components: heart, blood vessels, and blood. So, heart is a pump, blood vessels is the transfer structures or the ways through which blood is transferred into the body, and the blood basically is the medium that helps transport these nutrients and this oxygen and carry away the wastes. Now, the heart itself, it's a muscular pump. It's a double pump that pumps the blood and receives blood. So the heart pumps blood into arteries and then receives blood through veins. The blood on the right side of the heart, because it's a double pump, it is deoxygenated or lacks oxygen. And on the left side is oxygenated or is rich in oxygen. Generally speaking, the blood that is oxygenated, its color is bright red color. And if it's deoxygenated, it's dull red, like brick color. And then it's a muscular organ, and it propels the blood into the body. And we will see the characteristics of the 2 circuits into which the blood is pumped. And then the location and basic anatomy of the heart. The heart is located in the thoracic cavity, in between the lungs, in the space that we call a mediastinum, is the upper mediastinum. And it is protected partially by the lungs, posteriorly, of course, by the vertebrae, and anteriorly by the sternum and the ribs. And it's located towards the left side. And it is connected by major blood vessels like the vena cava and the aorta and the pulmonary trunk. And it's protected by membranes that we know as the pericardial cavities. So, the shape of the heart is a cone shape. The cone has a base, it has sides, and it has an apex, which is the tip of the cone. So it's an inverted cone that is located in the thoracic cavity with the base facing towards the right side, upper right side, and then that's the base. The apex faces to the left, specifically contacting the 5th intercostal space, the 5th space in between the ribs, in the mid-clavicular line, that in the case of males, is at the level of the nipple. That's the 5th intercostal space, mid-clavicular line. And then on the right side is at the level of the 2nd intercostal space, just on the side of the sternum, where you have the connection between the manubrium and the body of the sternum into what we call the angle of Lewis, and this is where you have your base. Now, for the size, it is relatively small, according to the size of our fist, and it weighs around 250 to 350 grams. Now, of course, there will be cases where the heart for health problems will grow in size, like in the case of hypertension or high blood pressure. In that case, the heart will undergo hypertrophy, become bigger. And of course, the size of the fist will not become bigger. But then you know that regularly the normal size of the heart has to be the size of our fist. And sometimes people have bigger hearts than others. And not only figuratively speaking, but physically speaking. Okay? So it has 4 hollow chambers, 2 upper chambers or compartments and 2 lower chambers. The 2 upper chambers are called atria. And then the 2 lower chambers are called ventricles. The atria receives blood from veins, and the ventricles pump out the blood through arteries. And normally, after we're born, these atria are separated, and the ventricles as well, by a wall that is called septum. If this wall is separating the atria, is called interatrial septum. Inter means in between. And if it's separating the ventricles, it will be called interventricular septum. And we should have communication between right and left side of the heart. That's after we're born. Before we're born, there is normal communication between ventricles and atria, and we will see why. Now, externally, there is an indentation or a little groove both between the atria and the ventricles and between the ventricles. And that can be seen, and that tells you that internally, that's the boundary between the atria and the ventricles. So we have a sulcus, that's the groove, that separates the 2 ventricles, that is called the interventricular sulcus, that corresponds exactly to the partition where the wall is, the interventricular septum. And then the atria is separated from the ventricles by the coronary sulcus. So why it's called coronary sulcus? Well, because an artery that provides blood supply to the heart runs in there, and that artery name is called coronary artery. And why it's called coronary? Well, because corona in Spanish means crown. And crowns of some royalty in the past, they used to be wear like this, in here, in the forehead. So it's like if this coronary artery run in the forehead of the heart. So we will see where that is located. And here is the heart in situ, in the mediastinum. So this is the anterior view of the thoracic cavity. Of course, you have removed the sternum and the ribs. So here, this is the heart. It has this base and this apex. To the base, you have connection of these major blood vessels. And this space in between the lungs is the mediastinum or mediastinum. I don't know how it is pronounced, but this is the space where the heart is protected. Now, the apex, this is the one that I told you that is located in the 5th intercostal space, and the midclavicular line is actually anchored to the diaphragm. If you remember, the diaphragm is the muscle that separates the thoracic cavity from the abdominal cavity by a ligament, so that the heart, when it's contracting, it is not going like crazy, moving a lot. So it is anchoring here, and it is anchoring here, the heart. And if you see, it has an oblique position, so it's like this, and it's a little bit rotated. So because of that rotation, you can see more of certain chambers than others. We will see that in a bit. But this is the anterior view. Now, in the lateral view, you can see how the apex and part of the inferior part of the heart basically rest on the diaphragm. And here, this is the lateral view where some of these great vessels, that's the name, connect into the base of the heart. And now, if you make a transverse section of the heart like this, you can see the transverse cut of the lungs and the transverse cut of the heart, showing you some of the chambers and the wall and the membranes from the heart. And here is the sternum, and here is the body of the vertebrae, the thoracic vertebrae. And here we have the esophagus and part of the blood vessels. The esophagus, it is one tube that transfers the food from the mouth into the stomach. Any questions? So, this is what I told you before. The atria is the upper chambers of the heart that basically receive blood from veins. So veins deliver blood into the heart. And then the blood will move from the atria into the ventricles. And then the ventricles will contract, will pump the blood into the arteries. And the arteries deliver blood either into the lungs or either into the rest of the body. The ventricles are larger than the atria. This is like kind of not a common word that you will hear. First, because it is not used so much anymore. It's kind of an antique or an old word, and it comes from some houses or some buildings, I guess from Greece and that area of the world. But basically in some houses, before the main room, they had a tiny room that it was called the atrium. It's like a little porch, an atrium. So that's where the guests used to sit before coming into the main room. So the atria in the heart is smaller in comparison to the ventricle, the main room. Okay? So atrium, I think it's a Greek word. So this is a frontal view of the chambers of the heart, showing you what in anatomy and physiology books they do to illustrate that the heart is a double pump that handles different type of blood. So here is a coronal section, and then here these two are the atria, and these two are the ventricles, separated by the interatrial septum and interventricular septum. Guys, for those of you who haven't taken class with me before, and I mean, anatomy by itself has its language with words that are hard to pronounce, plus my accent. Well, my accent is not only for English, it's even in Spanish. I have a tongue tied, so I'm sorry. Try to follow me, okay? So this is the interatrial septum, this is the interventricular septum. And blue blood represents deoxygenated blood. Red blood represents oxygenated blood. So right side, which is this, represents deoxygenated blood pathway. This one, oxygenated blood pathway. So then, this double pump pumps blood into different parts of the body. Left side pumps blood into the systemic circuit, into the body itself. So the blood goes from the heart up to your toes. That's the systemic circuit. Then the pulmonary circuit, the one on the right side, pumps the blood from the right side of the heart into the lungs. This is called pulmonary circuit. In Spanish, pulmón means lung, or in English. So lung is pulmón. So the pulmonary circuit goes from the right side of the heart to the lungs, is shorter. Then the systemic circuit, which goes from the left side of the heart to the up to your toes, to whatever part of the body, up to your toes. So then we have different events going on in each of these circuits. So for instance, in the pulmonary circuit, you bring the blood into your lungs so that you can get rid of CO2. CO2 is a toxic waste. You don't want to keep it in your body. So you exhale or get rid of the CO2. And then you breathe in, you absorb oxygen, so you have external gas exchange. So that's the purpose of this pulmonary circuit. Get oxygen and get rid of CO2. Now, that's the pulmonary circuit. The systemic circuit, the purpose is deliver blood into tissues. Oxygen. Your tissues require oxygen to make energy. In your mitochondria, you have oxygen as the last acceptor of electrons to make ATP. And also, you not only deliver oxygen to your cells so that they can make ATP with this systemic circuit, but also you have nutrients and hormones that your cells require to be healthy. So then that's what happened with these two different circuits. So with one, you oxygenate the blood with pulmonary, and with the other one, you kind of basically deliver oxygen to the cells, and then you pick up waste like CO2. So here is the overview, the illustration of this pulmonary circuit, the shorter. So right side of the heart handles the CO2-rich blood. It pumps it with the right ventricle into this pulmonary trunk. This is the name of this artery. And then this pulmonary trunk subdivides into two different arteries, the right and the left pulmonary arteries, that brings the blood into the capillaries of your lungs. Capillaries are tiny blood vessels, the tinier blood vessels that we have. So these ones are the ones that are so tiny that allows the passage of oxygen really quick and the absorption of CO2 really quick. So you can have fast gas exchange. So then this deoxygenated blood, once it reaches the capillaries of the lungs, it will exhale that CO2 into the air in the environment, and then from the air in the environment, of course, if it's kind of healthy air, you will pick up oxygen, and your blood that was deoxygenated now becomes oxygenated, and that can get transferred into these veins, the pulmonary veins. And then the pulmonary veins brings oxygenated blood into the left atria. And then the left atria transfers the oxygenated blood into the left ventricle, so that the left ventricle now is ready to pump the blood into the systemic circuit so that the cells can receive that oxygen. So functions basically of the lungs is to oxygenate the blood that the heart delivers deoxygenated. So then the cardiovascular system is highly linked to the function of the respiratory system. If one fails, the other one would suffer. Questions? So for the systemic circuit, it starts with the pumping of blood by the left ventricle into the main artery in our body, which is called aorta. I had a class, guys, forensics, and I kind of believe that what the professor said, that he saw many cases of shootings and people got shot in the thorax. And he said, for some reason, the gunshots always follow major arteries. If someone gets shot in the thorax, for some reason end up in the aorta. And yes, I mean, kind of it's true. I don't know if it's something related to flow or something, but anyway, if someone get a problem with the aorta, ooh, it's bad, especially if you get shot, of course, because all the arteries of our body are coming from the aorta. So then all the branches of the aorta deliver the blood into the tissues by their tinier branches, which end up in being the capillaries. So these are called systemic capillaries from the tissue beds, the capillary beds. And then once the blood reaches these capillary beds in our tissues, in our body, then you deliver the oxygen, nutrients into these tissues, and then you pick up CO2 and wastes. And then you end up with deoxygenated blood coming into your end, your venous end of the capillaries, which absorb all of these wastes, and then you start merging all these capillaries, forming small veins merges, forming large veins, and then the large veins form either the inferior vena cava and the superior vena cava, which ultimately bring the blood into the right atrium. And then the right atrium then deliver the blood into the ventricle, the right ventricle, and then the right ventricle start the pulmonary circuit. So here is the overview, the illustration of this systemic circuit. So everything starts with arrival of oxygenated blood into the left atrium via the pulmonary veins. And then the left atria pumps the blood into the left ventricle, which pumps the blood into this major blood vessel, the aorta. And then the branches of the aorta deliver the blood to the tissue capillaries in any part of the body, including the lungs. And then you deliver oxygen, nutrients, you pick up the waste, and then all of this goes back into the venous end of the capillaries. And then these capillaries form small veins form large veins like the inferior and superior vena cava, which deliver the oxygenated blood into the right atria, which pumps the blood into the right ventricle. So, any questions? And just as the lungs function, it is highly related to the heart function. Of course, both systems are linked, pulmonary circuit and systemic circuit. Let's say that someone has a disease that is called pulmonary fibrosis, in which the person cannot oxygenate really well the blood. Well, in this case, you will receive less oxygen from the pulmonary circuit, so then your systemic circuit receives less oxygen, and then the cells will suffer. It's like all of a sudden someone cuts your paycheck, and you were used to receive like $1,000, let's say, per week. But now, instead of $1,000, you receive $800. And then you have family members that depend on those $800 per week. Would not they receive the same amount of money that they used to have before, the same amount of goodies that they had before? Yes. So if you don't oxygenate well your blood here in the lungs, all your cells are going to be suffering. So see how all of this is linked. Other functions of the heart, besides delivering oxygen, pumping blood and delivering oxygen. Well, it's actually maintaining blood pressure. Every time that our heart contracts, increases the pressure of the arteries. And that helps to push the blood towards the different arteries. And then once the farther away arteries have less pressure, and the veins has less pressure than the arteries, you have the circuit going on. Remember the principle of physiology, where things move from higher pressure to lower pressure, from higher concentration to lower concentration, from more to less. So that happens still in our circulatory system. So it helps then to maintain the blood pressure, and as well helps to regulate the amount of blood volume. Because when someone has excess of blood volume, your right atrium becomes more distended, and then produce a hormone that's called atrial natriuretic peptide that helps for the excess of volume to be excreted through urine, because you lose more sodium with this hormone. So now, instead of someone cutting your paycheck from $1,000 to $800, they give you $100 more, $1,100 per week. That's good, right? Then what do? Atrial natriuretic peptide. Tell your family members, guess what? We have $100 more. We can go to the movies and we can go eat more outside. You excrete more when you have more. Okay, so that's one of the functions as well of the heart. Regulate blood pressure and blood volume. Now our heart, it is surrounded by membranes that are called pericardial membranes or pericardium. And this pericardium is subdivided into different types. So the most outer pericardium, outer membrane, is called fibrous pericardium because it's made out of collagen fibers. And one of these fibers at the apex are the ones that anchor the heart into the diaphragm so that the heart won't be like floating as crazy. Sorry, guys. So then this fibrous pericardium, it is important to maintain the heart in place, and prevents as well the heart to stretch so much. Now, inside this fibrous pericardium, we have a much softer pericardium that is called serous pericardium or parietal pericardium. And this one surrounds the most inner pericardium that is called visceral. So this visceral pericardium is also known as epicardium. And remember, in most organs where we have a double membrane, like the internal and the internal is always called visceral, because visceral means organ, viscera means organ. And the most external is parietal, because parietal means wall. So the epicardium, epi means above, is above the cardium, which means heart. And then that's the visceral pericardium. And then the outer is the serous. And both of them are much softer than the fibrous. So the fibrous is more like an anchor. And then the two other ones, the serous and the visceral, are softer. They embrace the heart and they keep it cushioned, because in between the visceral And the serous pericardium, we have a fluid that is called pericardial fluid. More or less, an adult produces 150 milliliters of pericardial fluid per day and absorbs it as well per day. So we recycle that. And then sometimes people can have infections in the heart or maybe an injury that prevents this absorption of this fluid, and the person ends up with inflammation of the pericardium, and this is known as pericarditis. So they accumulate that fluid. And then as they accumulate that fluid in the pericardial cavity, the poor heart becomes all entrenched. It cannot beat. And then guess what? If you try to auscultate, to listen to the heart sounds with a stethoscope, the heart sounds will be muffled because the heart will be surrounded by so much fluid that you cannot listen to these heart sounds. And sometimes pericarditis, it is so severe, guys, that the person even can have what is called cardiac tamponade, in which the heart definitely stops beating. And that's a medical emergency. So, this is an illustration to show you the two membranes that makes the inner pericardium. So this is the visceral and this is the parietal. So it is like if you have a balloon, I guess for next course I can bring a balloon. If you inflate a balloon, or if you basically put water in a balloon, and then you put your fist against that balloon, and the latex of the balloon that contacts your skin, that will be the epicardium, or the visceral pericardium, and the other part of the balloon, the other part of latex that doesn't contact your skin, that will be the parietal, or the serous pericardium. And the fluid in between, the water, will be representing the pericardial fluid, okay? Now, sometimes during these types of emergencies, like tamponade, a person needs to have a surgery. And in this case, they can do a thoracotomy, basically opening the thoracic cavity so that they can access the heart or any organ that is located in that area. So in the case of cardiac tamponade, they perform these surgeries, or they can even insert a needle into that and then extract the fluid. And of course, they have to give antibiotics. It's not as just like, okay, you take away the fluid, but well, you don't want this problem to be recurring. So then, what is the function of this pericardial fluid? To lubricate and cushion the heart, because every time that every organ, no matter if it's the heart or even the intestines, guys, they are moving, they rub against the internal structure of our body, the wall of the thoracic or abdominal cavity, and the muscle itself, it is kind of fragile tissue, so that can damage the tissue. So it acts like a cushion, this pericardial fluid. And now our heart, it has a wall and it has a skeleton. The wall is made out of 3 layers. The middle layer, which is the most abundant layer, the thicker layer, this is the myocardium. And then it has an inner layer and an outer layer. The inner layer is called endocardium. Endo means inside. And then the outer layer is the epicardium, which is the pericardial membrane. And then both the endo and the epicardium are made of simple squamous epithelium. So it's one single layer of cells, flat, while the myocardium is several layers of muscle, cardiac muscle. And then this cardiac muscle and the valves of the heart that are located internally are arranged in a particular manner because we have a skeleton that is made out of connective tissue, like collagen fibers. And it forms a part of attachment for these cells, the myocytes, that forms part of the cardiac muscle. And it has a particular arrangement. It is like if it was a spiral. So from base to apex, it goes like this, these fibers, the fibrous skeleton. And it helps for the attachment of these cells and the attachment of the heart valve. Some people might have some diseases in which this arrangement is not perfectly as spiral as it's supposed to be, so they have this arrangement of this skeleton, and they have what is called cardiomyopathy, dilated cardiomyopathy. So they can be young people, young persons who they don't have apparently any heart problems, and suddenly they can have death because the heart fails. And that's one of the reasons in athletes they always search for this problem, because they have found that athletes sometimes they collapse in the court and they die because they never find out before that they had this disease. It doesn't give any signs and symptoms. Suddenly they just plainly die. Okay, so they can monitor that. So fibrous skeleton is made out of dense irregular connective tissue, and because of this arrangement, of a spiral-like arrangement, then every time that the heart contracts in that, remember that it's located in that oblique position, it contracts like this, like squeezing the blood from the apex going into the base, because in the base that's where we have the openings for exiting of the blood. So it's like a ringing motion. If you are unlucky and you have to mop with those old mops where you have to, string mops, where you have to squeeze in between the strings to basically dry it, you have to do these, guys, to squeeze it well, the water out. Not this way. You're not milking a cow. So you do it this way. So that's what our heart does. So it does this, so it can push the blood up from the apex into the base. And then we have the endocardium with this basically epithelium, simple squamous, that when the epithelium goes from the heart into the blood vessels, now it's going to be called endothelial cells. Endo means inside. Okay, so that's the endothelial tissue for the arteries or veins, and endocardium for the heart. So this is the view of the layers of the heart. So if you make a frontal section, so this is the wall and protected by this epicardium, which is this. And then here we have the myocardium and endocardium in here. Now, besides this membrane, this membrane itself will be the endocardium, the epicardium. We have a layer of fat here. And then we have blood vessels. When you will do the dissection of the heart in the lab, you will see the same. So you will see the heart surrounded by fat tissue. This is normal. This heart is so important, and any organ important, guys, that we have in our body, basically, it is surrounded by fat tissue, which is protected. Bad thing will be if that fat is inside the blood vessels, because you cut the circulation, you obstruct that circulation. So this is what I explained to you before, that cardiac tamponade is excess of pericardial fluid that basically can prevent the heart from beating, and causes will be trauma, so basically a physical injury, cancers as well, kidney failure, recent thoracic surgery, HIV, and other microorganisms, guys, can cause not only HIV, but bacteria, fungi can cause infections of the pericardium. So, again, treatment includes removing fluid with a needle or even with a thoracotomy if it's too bad. And then sometimes they find different viruses causing pericarditis, including COVID-19, Coxsackie virus, several viruses. Viruses actually are a number one cause of pericarditis. And even endocarditis, guys, can be caused by microorganisms. Don't think that only the pericardium can be infected, but also the endocardium. Let me tell you something. So, IV drug users, sometimes they don't use a clean needle unless they clean the area where they're going to inject the drug. So, when they inject drugs into their veins, they carry the microorganisms that normally we have in our skin inside into the veins and into the circulatory system. So the first part of the body that will become infected with these microorganisms that we have in the skin is going to be the right side of the heart. So they end up with right side infections, right side of the heart infections, of course the left as well, because once a microorganism goes into the blood, goes everywhere. But they end up with destruction of, by these microorganisms, of the right side of the heart valves, like the tricuspid valve. Okay, so that's, and with the clinical history and all that, sometimes they find this and they know what happens. So now for the great vessels. So we have basically major systemic veins like inferior and superior vena cava, which are often abbreviated as SVC and IVC, that both of them drain the oxygenated blood into the right atrium. And superior vena cava basically brings blood from the diaphragm up into the right side of the heart, and inferior vena cava from diaphragm down. Okay? Now, pulmonary trunk, which basically it is attached to the right ventricle, it delivers the blood into the left and right pulmonary arteries. In blood vessels, anytime that you hear the word trunk, that means that it's a white blood vessel that is going to split into minor blood vessels. So the pulmonary trunk is going to split or bifurcate into the left and right pulmonary arteries. And this will carry the oxygenated blood into the lungs. Pulmonary veins, depending if you have an anatomical variation or not, but typically you have two pulmonary veins coming from the right side, the right lung, and two pulmonary veins coming from the left. But sometimes you can have 3 on the right and 2 on the left. So a maximum of 5. All of these pulmonary veins bring back the blood that was oxygenated in the blood, in the lungs, bring it into the left atrium. So pulmonary veins carry oxygenated blood into the left atrium. And then aorta. Again, this is like the main artery in our body. This one carry oxygenated blood into the body through its branches. And the first part of the aorta is called ascending. And it has an arch, and then it has a descending part, which is the largest. And out of the ascending, you will have the two coronary arteries, the left and the right, that provides blood supply to the heart. So then the first organ in our body that receives oxygenated blood will be which organ? To see if you're paying attention to me. Someone who's cooking. for big family or in a restaurant? Do you think he's going to be so altruistic and then do not eat while he's preparing the meal to serve the other first? Or what does the person going to do? I'm cutting some melon, etc. Why does cooks do that? Why they eat while they're preparing the meals? It takes a lot of energy cooking, guys. Imagine if that person doesn't have strength. So it makes sense that the heart will be the first organ that receives its own blood supply. So that's why it makes the coronary arteries first. And then when it comes time to serve, people will be, why don't you eat? Well, I was eating while I was preparing. So here is the anterior view of the heart, and the blood vessels. Time is it? We finish at 3:15, so we have more or less 10 minutes. Okay, so base here, apex in here, left side of the heart, right side of the heart. Upper chambers with two extensions that are called auricles, like ears. So these are the atria with the auricles. This is the right, this is the left. Ventricles, right and left. This sulcus that demarcates or shows that internally there is a septum, this is called the interventricular septum. And in this sulcus. And in this interventricular sulcus, we have the running of the anterior interventricular artery and the great cardiac vein, which are branches. Well, the branch of this left coronary artery, which is this, it is this anterior interventricular artery. And here, in this sulcus, which is the coronary sulcus, we have the right coronary artery, and this is the left. And here is so this is the right ventricle. Here is the pulmonary trunk. So this pulmonary trunk is connected to this right ventricle. This is the one, the right ventricle, that pumps the blood into the pulmonary trunk so that the blood can go into the lung in the pulmonary circuit. And this is the one that subdivides into the left and the right pulmonary arteries. So then once the blood gets oxygenated, it will return into the left atrium by these two left and two right pulmonary veins. And then you will see as well how externally in the heart, the fat tissue will be located more within this sulcus. Why? Because they are protecting these blood vessels externally. And then here we have some blood vessel branches of this right coronary. Now, look at this. So we said this is the right atrium, left. This is the right ventricle, this is the left ventricle. And this is the apex, this is the base. And here we have the aorta. Now, looking at it, which ventricle do you see the most? The left or the right? Say it loud. Say it loud. Come on, hello. Show your stripes. Come on, don't be over shy. Okay, I don't know you. Anyone else? The right. So that's how I told you the heart is not only like this, it's not perfectly anterior like this and perfectly flat like this posteriorly. It's also rotated like this. So then where do you expect to see most of the left ventricle? Anteriorly or posteriorly? Posteriorly, because it's rotated like that. It's like, okay, well, if I was the heart, I wouldn't be looking like you like this. I would be like, okay? So, who cares about that? Why is Sully showing me something that's not even in the textbook? Maybe it is, but it doesn't tell you why. Well, it turns out, guys, that when someone has hypertension and enlargement of the heart, this left atrium also enlarges, bulges out posteriorly, and is going to compress the esophagus. And guess what? What is this, one of the signs of a person with chronic hypertension that it hasn't been treated before when it's compressing the esophagus? Do you think the person is going to be able to swallow really easily? No. Guys, it took me years to learn that. And it wasn't even in the textbook. Someone told me. A doctor told me, you know what, this is what happens. This is why X, Y, and Z is having these problems of dysphagia. That's how you call it. Because the left atrium is compressing the esophagus. And now, I got it. So it's kind of weird how this tiny detail of that rotation can affect people that is unhealthy. So that makes anatomy and physiology more interesting than just plainly telling you, well, this is that. I mean, everyone can read about it, and then why are you sitting there just listening to me? Are you paying your money just because you have the money there to pay me? No. I will show you more than what is in the textbook and the whys. Okay? So, this is the same view of the heart, but not in a specimen. And of course, this is enhanced. I mean, this is not the way that you will see your heart that you're going to dissect in the lab. So basically, they remove the pericardium and they kind of injected internally some of these arteries so they look more plump. But this is how a specimen looks like. Okay, so you have the basis for that. Now, in the posterior view, then of course, you will see more of the left ventricle, a little bit of the right, more of the left atrium. Like I told you, this one will compress the esophagus when someone has dilation of this, and then a little bit of the right atrium because of that rotation. And something else that you will see, it is how the superior and inferior vena cava drain into the right atrium together with the coronary sinus. What is the coronary sinus? Well, it's a dilated vein or a part of a vein that is dilated that receives blood from all the veins of the heart, including the great cardiac vein anteriorly, and then this small cardiac vein, and then all of these three delivers deoxygenated blood into the right atrium. Something else that you will see is the posterior interventricular artery, which is basically the opposite of the anterior interventricular artery. And the left coronary artery, when it goes around the heart, to go posteriorly is called circumflex. Circumference means around. So circumflex is one that goes like this. So it's called first left coronary and then becomes circumflex. The right coronary always will be the right coronary, but the left becomes the circumflex, which is this. And now through these different branches, when they become obstructed, doctors can tell what part of the heart will be potentially having necrosis, which we call myocardial infarction. So depending on which branch is obstructed, it will be what part of the heart will die. So it's time to leave. Now, for those of you who are in the Thursday lab, of course, we don't have lab today, but we will have lab a week from today. And then, of course, we will have on Wednesday the lab for those of you who are in the Wednesday section. Let me stop the recording.